62 in Brooklyn, 34 in the Bronx, 19 in Staten Island. I am very, very sorry to say that we now have 2 additional deaths, or a total of 7 people have passed away. The first is a 56-year-old man from the Bronx who worked as an investigator for the city government. This is something we are feeling all personally. One of our colleagues in public service has been lost. Investigator, Department of Correction. We have checked the logbooks for his work in recent days, and to the best of our knowledge, he did not visit the inside of a jail facility. He worked with one fellow employee closely. That individual is self-quarantined. So to our Department of Correction colleague who we've lost, our condolences to his family. Our hearts are with them, our prayers are with them, and we will do all we can to help them in this incredibly difficult time. We've also lost an 89-year-old man who returned from Italy about a week ago, and we grieve also with his family and loved ones as well. We see consistently that we keep losing people overwhelmingly in those same categories of those who are older, particularly much older, and those who are vulnerable because of pre-existing disease. Now, what we are going to do to expand our capacity. We understand that this curve is moving rapidly. We're going to have to radically expand our healthcare facilities in New York City and capacity. Again, this is going to be a war basis in New York City. I do not believe the United States government is on a wartime basis right now. I think it's painfully evident. If they were, we would already have immense support from federal agencies on the ground right now. I do see a beginning of federal support, but nowhere near what it should be at this point. So we will do it ourselves to the maximum extent possible, and I've ordered all my colleagues to identify all spaces that can be converted immediately to medical use. We're going to start with those that are most obvious, that already are engaged in healthcare and either being underutilized or not utilized, and then we are going to go much farther. So I think you have to think of this in a wartime worldview. You have to think of this as something where you're going to see a massive mobilization to save lives, to help people through their suffering with this disease. A lot of people who are hospitalized, the vast majority of people who are hospitalized will survive, but they'll go through a very difficult experience. Again, basically, the numbers keep holding. About 80% of everyone who gets this disease does not require hospitalization, has a fairly mild experience. 20% have a much more serious experience. Overwhelmingly, those folks need hospitalization. The ones who end up with the most serious problems in the ICU, and there is the category where we see ourselves losing people, particularly among the older folks with the pre-existing conditions. What that says to us with this kind of steep increase in number of cases is we're going to need massive medical capacity on a scale we've never seen in the history of New York City before. So we are going to be constantly building out medical facilities and creating them where they have never existed before, and retrofitting facilities that have nothing to do with healthcare. We will turn them into hospitals so long as we can get the equipment and the personnel. We will keep building our capacity to meet the demand. We've had a lot of conversations internally about how we're going to achieve this. The personnel are the single most crucial element. Thank God we're in a city with a vast number of healthcare personnel, but still nowhere near what we might eventually need. So we're going to find many ways to take people who are in other appropriate parts of the health profession, help them maximize their ability to serve, look for folks who may have retired recently who could come back, students who could be appropriately credentialed to be brought in. I predict in this, if it continues to be a situation where our area and others like Washington State are disproportionately suffering in the context of the whole nation, that we're going to ask the federal government to send in healthcare workers from other places to help. Clearly, we're going to ask for the military's medical units to come in, which are very effective, and that's a substantial amount of military personnel. We're going to need all of that to get through this, and we'll have more to say on it as we go along. Facilities that we are immediately bringing online, and this is a combination of some public facilities, some private, that we will, in this instance, working with their owners, we will put them into public service, and obviously we will compensate for it. And we're going to work the same with the voluntary hospitals to maximize their capacity. But I can report 4 new facilities being brought online immediately. The Kohler facility on Roosevelt Island, an H&H facility that was empty. It is being immediately brought back online, 350 beds. It will be ready in approximately a week's time. There is a recently built nursing home in Brooklyn that had not yet been occupied. And again, we'll get you more details as the announcements are ready and final notifications and confirmations are achieved. But this is very likely coming online in the next 2 weeks, 600 beds. The Westchester Square Hospital in the Bronx has an available approximately 150 beds, and we believe, again, likely to come online in the next 2 weeks or so. The North Central Bronx Hospital, part of H&H, has 2 floors that are vacant with 120 beds. This will be activated immediately within a week's time or so. That gives us somewhere in the neighborhood of 1,200, 1,300 beds that we can immediately say will be activated. Then when it comes to existing health and hospitals facilities and voluntary hospital facilities, a 3-pronged strategy. Discharging patients on an expedited basis, obviously in a manner that is still healthy and appropriate. Canceling the elective surgeries as is ordered in my executive order under our state of emergency. And building additional capacity within hospital buildings. The example Dr. Katz gave, turning a cafeteria into an ICU, turning a parking lot into an ICU with a tent. Those 3 strategies between our existing health and hospitals and the voluntary hospitals, we believe will net us an additional 7,000 new usable beds, meaning new because they will be available for the cause of fighting coronavirus. So with that estimate, 7,000 beds capacity plus the 1,300 almost that we will bring into play from the other 4 new locations, that will take us to 8,200, 8,300, and then we're going to keep going rapidly from there. But this will be a race against time to create these facilities, to get them up and running, to find the personnel and the equipment we need. We have no choice but to expand rapidly and be ready for anything. It would be, I think that my colleagues in healthcare would agree, much better that the facilities are up and ready too early than too late. In terms of space for any individual who needs to isolate or quarantine, and or for city workers who we need to keep in that kind of location rather than sending them home, we're getting additional hotel space immediately. We have identified and are acquiring space in 5 smaller hotels that will amount to 250 hotel rooms, but we'll be building out from that rapidly. In terms of tents for medical use, the kinds of tents that can be used to set up a medical facility or an ICU, our emergency management team has already acquired 11 such tents, with another 10 to 20 coming in the coming days, and are working out the distribution of those tents between public and private facilities. We now have, as a result of the President's state of emergency, again, the real time here, everyone, is just staggering. We had the President's state of emergency just a few days ago, the congressional vote, the House vote just a few days ago. Everything is really moving fast. But when the President signed the state of emergency, that put FEMA into play. And this is crucial. We need FEMA to be part of the solution. Our Commissioner for Emergency Management, Deanne Criswell, was a former senior official at FEMA, understands exactly what capacity and resources they bring. So this is a very important dynamic to have FEMA involved, and they have immediately gotten to work with us. We will be standing up 5 drive-through testing facilities across New York City. Details are coming together about where they will be in the city. I want to emphasize, and I can't say this strongly enough, and I'm sure my health colleagues will say it even more strongly, these facilities will be for priority testing, not for anyone, not for whoever walks up, and that's not said with any lack of respect for anyone. It is clear we need to test on a priority basis the folks in greatest need. We have to protect our healthcare professionals. There are specific categories that we need to focus on. Testing will be based on priority and reservation, and we will have details on that soon as they're up and running. But there will be 5 drive-through testing centers set up in New York City. And again, thank you to FEMA for working with our Office of Emergency Management and our Health Department to do that. Just some other items I mentioned in our correction system that we will be suspending visits. I want to emphasize this is also the kind of decision that should never be made lightly. For those who are incarcerated, it's something they will be lacking and missing greatly. We will come up with alternatives, as I said, more phone calls, hopefully video conferencing. But it was absolutely necessary to protect the health of all those who are incarcerated, and obviously, very importantly, our correction officers who we are depending on greatly at this moment. They have a very tough job. Their job is crucial. We need to protect their health and well-being. That was a driving factor as well in making that decision. We are announcing a new emergency rule from our Department of Consumer and Worker Protection. I mentioned a few days ago specific actions that were being taken to delineate products that were becoming scarce and to institute anti-price gouging measures. We are taking a much deeper step now. An emergency rule banning price gouging on supplies needed to treat or prevent coronavirus. I'm going to list them for you. And so for all the folks out there who sell these items, we are deadly serious. You need to not only not price gouge, you need to understand you have an obligation to your fellow New Yorkers to make sure that people can get these crucial supplies. It is not time for profiteering. It is time to be a good citizen and help your fellow New Yorker. The items are thermometers, sanitizing wipes and or baby wipes, paper towels, latex gloves, face masks, fever reducers, cough suppressants, zinc oxide supplements, facial tissue, toilet paper, rubbing alcohol, and aloe vera. And apparently, I did not know this, rubbing alcohol and aloe vera can be mixed together to create a version of hand sanitizer. So those two make the list. Retailers cannot increase the price of these items by more than 10%. That is the rule, and every time there is a violation, there'll be a $350 fine per instance, and that means it can add up very, very quickly if someone is violating that rule. In terms of supply chain, we have been studying carefully. I've asked our Emergency Management Commissioner to constantly reassess the supply chain and update me. At this moment, the good news is on food and basic household goods that you would find in a supermarket, there has been actually a very intensive resupply in recent days. That's the good news. The bad news is stuff is being snapped up really, really quickly. I remind people, We are going to work to ensure that the supply chain remains strong. We need our federal government to do that in a way that's far beyond what we can do. But while this is all proceeding, we need our fellow New Yorkers to look out for each other. If you're someone who's bought a lot of everything, God bless you. But if there's someone in your life, someone older, someone with one of those pre-existing conditions, someone who has a disability that keeps them from getting out and getting supplies they need, either help them by getting what they need for them or share your supply enough to help them out. I know we are in a society where people have been taught too much just to look out for themselves. We're going to enter an entirely different human reality and societal reality. We're going into something that people in this generation have not experienced before, but in previous generations they knew way too well. And everyone's going to have to figure out how to work together and share. So if you have an overabundance and you see someone who doesn't have anything, please help them out. Few other points, one related to that. We're very concerned about isolated New Yorkers, for the folks who have to stay home because they're vulnerable, for the folks who are in isolation for medical reasons. We want to help them out and communicate constantly with them. And this is whether it's someone who is a confirmed patient with coronavirus or just experiencing sickness but not yet confirmed, and certainly for folks who have to be very, very careful and stay in to the maximum extent. We are going to create what is being called an isolation app. Department of Information Technology and Telecommunications has put this together. It will be up quickly. It will provide guidance in 9 languages. It will ask if individuals need anything, and they'll get real-time responses. And also will give us good information on what challenges people are facing, where we're having particular problems across the city, et cetera. Finishing up, obviously now with the action on restaurants, bars, cafes that serve food, a crucial issue will be food deliveries. I got the question the other day whether we would suspend enforcement on e-bikes in terms of deliveries. The answer is yes, we are suspending that enforcement for the duration of this crisis. Okay, a few more things, and then we will start to take your questions. We're going to, all of us up here, especially the health professionals, we're going to repeat ourselves a lot over the next weeks and probably months. So let's begin with the most important point, which is stay home as much as you can. That guidance might get a lot sharper at any point. I have been asked repeatedly, are we considering travel restrictions? Are we considering curfews? We are considering everything is the answer. Every option, every tool is on the table. We will decide in turn when we want to employ each. But right now, the answer is simple. Stay home to the maximum extent possible. Protect yourself, protect your family. In general, the simple rule is when in doubt, stay home. If you're not sure you should do something, stay home. We're going to talk about some things that, if you're healthy, are still appropriate to do, like getting food and medicine. But again, the simple guidance to all New Yorkers is, if you're not sure you need to do it, stay home. If you have any option, then you don't have to go out, stay home. Limit your time outside your home or your apartment. When you go out, be mindful of social distancing and try and distance as best you can. Those are some very simple rules. For folks who are sick, it's a stronger version of stay home. Stay home. Don't even think about going out. Try as best you can to get the people in your life to get that food for you, get those medicines for you. Obviously, there'll be deliveries. Do not accidentally put someone else in harm's way. If you must go out, if you're someone who is sick and there is literally no other way to get food or medicine, you can't find anyone else who will do it for you, you must go out, You should be out for as little time as possible. You should keep your distance. You should help people around you know to keep their distance. If you are sick with the symptoms, again, I'm keep using simple layman's terms. The doctors will always feel free to improve upon them, but cold and flu-like symptoms. Our guidance has changed in the last few days. We are saying stay home for 3 to 4 days. If you're getting better after that time, that's fantastic. Stay home until you're well. If you're not getting better, call your doctor and act accordingly. Crucial piece of information. Do not go, now that this crisis has advanced, do not go to the emergency room unless it is actually an emergency. If you are in an absolute dangerous situation health-wise right now, that's what the emergency room is still for. Otherwise, if you're just worried that you might be getting sick, I want to tell you more and more what you're going to see at emergency rooms. You're seeing it now all over the country, as you will see officials of that healthcare facility outside screening and turning away people who do not need emergency care. So the better way to do this is to not go unless you absolutely have to. We cannot overwhelm our healthcare facilities. We have to make sure the folks who need help the most are getting the care. Finally, just trying to give some examples for the many, many New Yorkers who are not in those particularly vulnerable categories. You're not over 50 with the serious pre-existing conditions. You're not over 70. You're a healthy New Yorker and you're trying to figure out what to do. So when in doubt, you still stay home. But we understand that people need to stay healthy. We understand that people under any circumstance, if they have the ability to get a little fresh air and exercise, that's actually quite important to their health. We understand that people need groceries, they need medicines. In these instances, it's okay to take a walk, but practice social distancing. It's okay to go jogging, but practice social distancing. It's okay to walk your dog, but practice social distancing. If you don't need to go get groceries because someone else can get them for you, that's great. If you can get a delivery instead of going out, that's great. But I understand that there's so many people who are healthy who are trying to figure out what to do. Some basic, simple things like getting some exercise or getting some fresh air. I've spoken with all of our key health officials on this. Everyone agrees that's acceptable if you keep it limited and you practice social distancing. That's where we are today. That could change tonight, that could change tomorrow, but that's where we are right now. So everyone understands that this is going to be a very difficult few months. It will definitely get worse. It will get a lot worse before it gets better. I don't take any joy in saying that, but people expect our leaders to talk straight with them. It will get a lot worse before it gets better. We understand that so many people are going to be affected by this. But again, the answer is not fear. The answer is not panic. The answer is not, I'm going to sit around and hope that someone else will save me or the government will take care of everything. The answer is for all of us to work together and support each other. The answer is for us to believe in each other, support each other, look out for each other, and understand that everyone has a role to play. Everyone has a chance to do something really important for their fellow New Yorker and for someone in need. Everyone has a chance to exercise personal responsibility, listen to the guidance and abide by it, but also listen to the idea that even your city government, your federal government doesn't reach into every nook and cranny of our lives, but people do. Our family does, our neighbors do, the people on our block do. And we saw this after Sandy. The people were helping each other before any government agency could arrive. And I was very moved by it when I went through neighborhoods in Brooklyn and Staten Island and saw the amazing things people were doing to support each other. We're going to need that again now. That we are going to do everything we can as your city government. Everything we could possibly imagine to do, we will expend every resource. We'll do things that have never been seen before in the history of New York City. But in the end, New Yorkers will play a crucial role in helping us get through this crisis and in helping us overcome this crisis. And I have absolute faith in my fellow New Yorkers that you are more than up to the challenge. Few words in Spanish. A partir de esta noche, estamos cerrando algunos negocios en la ciudad de Nueva York. Todos los neoyorquinos tienen la responsabilidad personal de tomar precauciones, ser inteligentes y proteger a los más vulnerables. Los próximos meses serán dolorosos, pero juntos superaremos esta crisis. Okay, we covered a lot there. Let us open up now to your questions. My colleagues will join in as we go along. Rich.
So, I just looked it up, Mr. Mayor. Anthony Fauci is 79 years old.
Yes, he is.
So, did he give you any sense of if he is fearful about himself? Or?
No. He's been quite clear about that. He said, he was asked, has he been tested? He said, no, I'm not sick. I think he's exactly what we should be looking to as a role model. Amazing story. I was looking it up the other day. Here's a kid who grew up in Brooklyn. His family had a pharmacy. He used to deliver, the prescriptions to people's homes in Brooklyn. And boy, when he talks, you know where he's from. And what an admirable guy and someone we should be proud of. But he was quite clear. People need to take common sense precautions, especially those in greatest need. But right now, I think, look, Dr. Fauci's in the same situation we are in. We have to, all of us, have to serve the public. We are not going to be able to look at things the same way everyone else does on one level. We are supposed to put ourselves in harm's way, not to be reckless, obviously, but we're supposed to stay at our post no matter what, just like our first responders, our health workers. So this is a situation where public servants are in a very different category than everyone else. We are supposed to do everything within our power. A number of us may get sick. That's the price of admission. We're asking everyday New Yorkers to really be cautious and careful. But we are holding ourselves to a different standard, a higher standard, because we signed up for putting ourselves in harm's way, and that's fine. No one has a problem with that.
Given your own guidance that you just gave to New Yorkers about stay home to the maximum extent possible, you received a lot of criticism for going to the gym today. Do you want to explain your thoughts
Sure.
behind that? And then if Dr. Barbeau or a medical professional wants to weigh in on how safe that was.
Absolutely. I knew in advance that it was a very socially distanced situation. There was almost no one there. I had heard that information prior. I suspected that we were all going to be about to close them down, and this would be the last chance to get some exercise. I got no exercise whatsoever over the weekend. I was in this building a huge percentage of the time. I need exercise to be able to stay healthy and make decisions. I'm going to figure out some new way to do it going forward. I did not for a moment think there was anything problematic because I knew the dynamics. And again, I have to stay healthy so I can make the decisions for the people of this city.
Other people, I mean, other New Yorkers too, you've asked people to make sacrifices. You're not the only person in New York that needs exercise to stay healthy. People have found other ways to adapt. Right. Do you think it was irresponsible for you?
No, you can ask 100 different ways. I'm very comfortable with what I did. They're all closing down today anyway.
Could a medical professional perhaps?
Sure.
Yes. I'm a practicing doctor. I support the mayor's decision to get exercise today.
I know some people who have already been laid off from their jobs. What steps should people in that situation do right away?
When they've been laid off? Look, this is something, that obviously there's actions being taken on unemployment insurance, for example. But we're going to need something much deeper than that from the federal level. We're going to need direct income replacement. So I used the example earlier today about the New Deal, and it's a very different physical reality. But just play it out in your mind for a moment. Remember, as soon as the New Deal, as soon as the Great Depression hit, a previously prosperous country with very low unemployment went in short order to 25% unemployment. My grandparents were among them. And the stories I heard, they had a small business in the garment district, and it was wiped out very quickly. And the stories I heard from them, from my grandfather, about the ways people came together to help each other and support each other were very, very powerful. Just everyday people helping each other survive. But then very soon after, once Franklin Roosevelt became president, these miraculous things started to happen, like massive numbers of government jobs. Now, coronavirus is different because we can't create massive employment when people can't gather, obviously, but the notion is the same. The federal government did something unheard of. There was no precedent whatsoever for it. It was night and day from what had been known a year earlier even. And they created a massive infusion of money into people's pockets through government-created jobs, and it saved America, literally. Saved America from falling apart. Right now, I'm asking this administration, this Congress, to create today's version of that. Replace people's incomes. Not just unemployment insurance, which is nowhere near what people made, but replace their incomes to the maximum extent possible. I'm sure it may not be exactly the amount that everyone makes, but it has to be enough for people to afford the rent, food, medicine, the basics. If we don't do that, you're going to see a tremendous amount of pain and a danger of a further collapse in this country. Let's be blunt. They have the money. They just did, $1.5 trillion, $1.5 trillion tax break for the wealthy a few years ago. Endless expenditures on the military with very little assessment of whether that's the best use of money. Endless wars that are getting us nowhere. There's money. It's going to the wrong place. It should be going to the American people in a time of crisis. So I take to heart what Senator Schumer said right here on Saturday, that this bill is going to be followed by another bill. That next one needs to get to direct income replacement. Yeah.
Mayor, have any higher-up-ranking Department of Health officials threatened to resign in recent weeks over disagreements with you and your staff about the handling?
No.
Is there any truth whatsoever to these? I mean, there's been press accounts of...
I don't know about the multiple press accounts. If someone wants to bring me specifics, I know nothing about that. I know people have had serious conversations trying to make decisions together. I know when someone comes up to me and says, I want to resign. That has not happened.
Mayor, on the expansion of hospital capacity, can you...
Just a little louder.
The expansion of the hospital beds, are there other facilities that you're looking at? Are you looking at expanding it beyond healthcare facilities to
Yes.
armories and, other...
Anything and everything, but it will be... Look, anything healthcare related, obviously, Aaron, is better because there's certain advantages to a facility that was built for something like that. But we're going to look at anything and everything. Again, it will be very much related to the extent of the mobilization we can achieve, depending on the personnel available, the equipment available, and the federal presence. If the military will come in a big way with their medical capacity, that would help immensely. If we're able to get, if we get to this point, healthcare professionals from other parts of the country brought in on a systematic basis. So again, I don't understand what the federal government is doing. I cannot believe what I'm seeing. It should be a full national mobilization. Look, I've had my differences with certain decisions our military have made over the years, but I come from an Army family. I would trust the Pentagon right now a hell of a lot more than the White House to figure out how to sort out this crisis and address it. I wish the president would just call up the Secretary of Defense and say, you take over, I don't know how to do this. But if we could put this on a war footing, and you have states in the union that have very little presence of coronavirus, we need healthcare professionals here.